Okay, we're good, Joe.
Okay, y'all. My name is Joan Chang. I use she, her pronouns. I'm a staff attorney here at Community Legal Aid SoCal. And today we're going to be talking about Medi-Cal budget cut changes. Lots of stuff happening in the world of Medi-Cal right now. I'm giving y'all a heads up that there's a lot of slides that we're going to go over today. I'm going to go a bit fast, but again, the recording will be available for y'all. But please, if you have any questions along the way, feel free to ask them, while we throughout the presentation itself. You don't have to wait until the end. I want to make sure we're, answering the questions about the slide that we were just looking at. So feel free to ask questions along the way. So the slides will be available via email. I think Kim could go ahead and email all the registrants, and then the recording will also be on the Caregiver Resource Center YouTube page. Okay. All right, let's dive in because I know we have a lot to cover today. If you've attended one of my presentations, I'm a fan of the red pen. Can y'all see the red pen and the line underneath?
Yes.
Can I get
Yes.
yes, thank you. Thank you, Kim. Okay, let's dive in. Today's agenda. This is kind of gonna be our roadmap. Medi-Cal budget changes. We're gonna answer three questions. Remember, like in elementary grammar school, we had like who, what, how questions. We're gonna be answering some of these questions. Who is gonna be impacted with these Medi-Cal changes? What Medi-Cal services may be changing? And how you get Medi-Cal services may also be changing. So we'll go through it and we're going to have a more detailed outline here. Okay. Who? We're going to talk about different populations. It's going to be Medi-Cal for undocumented immigrants. We're also going to talk about humanitarian immigrants. We're going to go into details to which immigrants fall within under these quote humanitarian immigrant populations. We're also going to be talking about our non-Magi folks. We'll talk about what that means and the lower asset limit that's going to take place next year. We're going to talk about our adult expansion population. That's typically our 19 to 64-year-olds who are not disabled, who are not aged, who are not blind, who are not pregnant. There's different exceptions to this category, and we'll go into more detail. For this population, we're going to be talking about the work requirements that are going to be coming up and the renewals that are going to happen. Currently, renewals are once a year. For this population, it will change to twice a year. Okay, and then we're answering the what. The what services are going to change. GLP-1s no longer being covered for weight loss. We'll go into more detail about that later. The enrollment freeze for undocumented applicants. We'll go into more detail about that. The dental benefit removal for undocumented beneficiaries. The reduction in enhanced care management and community supports. Sadly, this is impacting every Medi-Cal beneficiary. It's not one particular population. And then the how you get your Medi-Cal services may be changing. So there will be eventually a copay. This is not a settled amount. It could be up to $35, but per service for an adult expansion folks. Again, we're going to go into more detail about who this applies to and who it doesn't. We're going to talk about reduced retro Medi-Cal. There's something called retroactive Medi-Cal coverage. That period, the retro period, is going to change and get reduced, and we'll talk about that and who that impacts. We're going to talk about the monthly premiums that are going to be tacked on for undocumented immigrants. And then the switch. There's going to be a switch for some folks who are considered, quote, unsatisfactory immigration status. I'm quoting it. I don't love this phrase, but this is the phrase that is legally being used. Those folks are going to be switched from a Medi-Cal plan into fee-for-service Medi-Cal. And we're going to talk about what that is and what that looks like. Okay, so this is going to be our roadmap for today, y'all. You're going to see this roadmap throughout the presentation. But I'm going to sadly go through some of these slides really quickly because I want to make sure we get through to the end and we have time for questions. But feel free to ask questions along the way too with particular slides that come up. Okay, we're going to talk about the who, specifically the undocumented immigrants. All right, undocumented immigrant populations. We're not going to talk about these folks just yet. Okay, the old policy. This is the history of what we call Medi-Cal for all. The old policy is, hey, let's give full scope Medi-Cal to everyone, no matter what age or your immigration status. We want to make sure Californians, no matter what their immigration status, if they're eligible for Medi-Cal, they should access full scope Medi-Cal, not just emergency Medi-Cal. This is the history of Medi-Cal expansion. I'm not going to go through it all, but this is what's happened since 2016, 2020, 2022, 2024. Unfortunately, we're kind of going back. We're going backwards here because of the budget cuts that are happening. We're kind of moving a little bit backwards. There is going to be an enrollment freeze for 19 plus year olds. And this enrollment freeze actually started at the beginning of the year. Keep in mind, though, for our 18 and younger undocumented populations, those folks can still enroll into full scope Medi-Cal. We want to make sure our young people, no matter what their immigration status, they still have access to full scope. Okay, let's break this down. Yes, so these folks will still have full scope if you are you want Medi-Cal, if you're undocumented and you're under 19 years old. Okay? So we're still good to go. You still get full scope if you are undocumented and you are pregnant. So if you are pregnant and Medi-Cal doesn't know you're pregnant just yet, let them know right away so that it's not going to impact your Medi-Cal coverage, and that you still hopefully remain on Medi-Cal. Okay, so our pregnant folks are still covered. Again, well, this is our former and current foster youth, and those are kids who are 26 or under 26 years old. If you are a former or current foster youth, you still get access to full scope Medi-Cal. So good to go. Let's get into kind of the red text here. If you are undocumented and you're 19 and older and you're not pregnant and you're not a current or former foster youth, again, starting January of this year, which has already happened, you're no longer going to be eligible to apply for full scope Medi-Cal. So let's see what this looks like. These same folks will still be eligible for emergency Medi-Cal, but you're just not going to get the full scope anymore. It's emergency only. All right, so this is an enrollment freeze. This enrollment freeze happened at the beginning of the year. So anyone who applies now or anytime you've applied since January 1 of this year, you're only getting emergency Medi-Cal, okay? For those who already had the full scope Medi-Cal because of all the expansions that we had in the past, you can keep your full scope Medi-Cal. That's the beauty of it. You get to keep your full scope Medi-Cal. You just need to make sure you follow all the renewals that come in the mail and you respond timely and that you maintain your full scope Medi-Cal. Okay, starting next year, July of next year, unfortunately, undocumented non-pregnant persons who are 19 plus who don't fall within any of these green categories, they're going to lose their dental services. Keep in mind, though, that emergency dental is still covered. So if you need dental services for Medi-Cal because of severe pain, infection, or emergency tooth extractions, you can still get those. But non-emergency stuff like cleanings, x-rays, things like that will no longer be covered for this undocumented, non-pregnant, non-foster youth, 19 plus population starting July of next year. Okay. And then starting July of next year, this same population, except it's going to be from 19 to 59, they will potentially have monthly premiums for Medi-Cal. Depending on the new governor, whoever that new governor is going to be, they're going to set the amount, either $30 a month or $50 a month. So we still have to wait and see for that information. Okay. This is just a timeline. It's exactly the same information that I just said here, but just in a chart format. So however you digest information, whether it's through text or chart, the same information is available to you. Okay, keep in mind, this is what full scope Medi-Cal covers, and this is what emergency Medi-Cal covers. So keep in mind, when you have emergency only Medi-Cal, you're not getting this stuff. You're not getting this stuff. You still get this stuff, luckily. Okay. Okay, so let's kind of look at this for folks. So say, for example, I applied today. We're in, what are we, 8? 10, 26. If if I am an undocumented person who's 19 plus, who's not pregnant, who's not a former foster youth, and I apply today for Medi-Cal, what kind of Medi-Cal am I going to be eligible for? Full scope Medi-Cal or emergency only Medi-Cal? Full scope Medi-Cal or emergency only Medi-Cal? A or B? If you want to take yourself off mute or put your responses in the chat. If I'm going to be
Emergency,
applying, someone said something.
me,
Yay, Pia. Go ahead, Pia.
emergency.
Yes, emergency only. Okay, so this person would only be eligible for emergency only Medi-Cal. So, but say for example, we had someone who already had the full scope. Okay. I already had, say I'm an undocumented, I'm not pregnant, I am 55 years old. I still get to keep my full scope even beyond January of this year. I get to keep my full scope. That's the beauty of it. You just need to make sure that I respond to all of my, renewals that happen with Medi-Cal, that yellow packet that gets sent out. I need to make sure I respond to that right away, and not lose my full scope. Okay. This was a presentation that I did back in 2025, but technically the doors have closed. So if you wanted full scope Medi-Cal and you were 19 plus undocumented and not pregnant and not a former foster youth, your deadline to apply for full scope Medi-Cal was December 31st of 2025. So that deadline's already passed. This door currently is closed. Who knows with, future budget changes that might happen. They may reopen this door, but for now it's closed. Okay, so this is that same information. Let's talk about this population here. Okay, so these are the folks who already had the full scope Medi-Cal. All right, they had it before all of these changes happened. They get to keep their full scope Medi-Cal, but they have what we call a 3-month expansion grace period. 3 months expansion grace period to get back on Medi-Cal. So if you ever get cut off for Medi-Cal for any reason, you have what we call a 3-month expansion grace period. If you fixed your Medi-Cal, whatever was wrong with it, you didn't submit your, renewal packet, you forgot to submit your pay stub with your proof of income, whatever it was that made Medi-Cal terminate your or cut off your Medi-Cal, you have 3 months to fix it so that you could still get your full scope Medi-Cal. If you go past the 3-month grace period, the only type of Medi-Cal you will be eligible for is emergency only. So you've lost that full scope door. Essentially, that door has closed. So let's look at this in practice, okay? All right, so say for example, me, I'm undocumented. I am, say, 50 years old. I am not pregnant. I'm not a former foster youth. I already have my Medi-Cal. But for some reason, and let's just say it's because I didn't renew my Medi-Cal, I didn't send my renewal packet back to the county. Um, my Medi-Cal got cut off back in June. From June to September, I have 3 months to fix whatever my Medi-Cal is, to fix my Medi-Cal. Okay, so right now I had the full scope. I got terminated and I have to fix it. If I fix it, I get to keep my full scope. Okay? Sorry, this is my chicken scratch with my mouse here. If I don't fix it, what am I going to be stuck with if I do reapply for Medi-Cal? What kind of Medi-Cal will I have? Full scope or emergency? If I don't fix it.
Emergency.
Emergency. Emergency. I'm just going to put ER. ER only. That's all we're going to be getting. So that's why it's really important to pay attention to your mail, pay attention to anything that comes from the Medi-Cal County office, because we don't want to lose our chance to keep and maintain our full scope. Okay. All right, so here's the summary for with some pictures, if that's helpful for y'all. For babies, for anyone who is younger than 19, if you're undocumented, you'll still get your full scope. You're good to go. If you're pregnant, you still get your full scope. You're good to go. If you are 19 and older, again, the enrollment freeze has happened. So if you apply anytime after July 1 of this year, you still get Medi-Cal, but it's only going to be emergency only. And then starting in July of next year, the full scope folks who currently have the full scope, they still will have full scope medical services, but they're no longer going to be getting the dental. So the little Ghostbuster sign over the tooth. And then again, starting in July of next year, there will be a monthly premium, either $30 to $50, depending on the amount that will be set by the new governor. And this will apply to our undocumented 19 to 59 folks with full scope. Okay, so this is just a summary of what we've already talked about. And then this is just a timeline of those changes. Okay. Any comments, questions, or concerns about this before we move on to the next population? Okay, I'm going to move on. Let me know if you have any questions. I'm monitoring the chat as well. Okay, we're still on the who question. Let's talk about our humanitarian immigrants. Humanitarian immigrants. Currently, humanitarian immigrants get full scope Medi-Cal. This includes refugees, asylees or asylum seekers, certain DV or trafficking survivors, and special immigrant visa holders from Afghanistan and Iraq. These are what we call the humanitarian immigrants. Starting in July of next year, these humanitarian immigrants are going to be shifted over from full scope to emergency Medi-Cal. It's a huge shift and a huge change. This was actually supposed to go into effect in 2 months, in October of this year, but the California budget extended it so that these folks will have and maintain their full scope Medi-Cal at least until July of next year. Okay, so again, this population will be shifting over from full scope to emergency only in July of next year. All right. Again, just to remind y'all, this is what full scope covers. This is what emergency only covers. This is kind of the fine print. You could go to the DHCS website. The link is here. This is what it says about that transition for the humanitarian population. Okay, we're still on the who. Let's talk about our non-Magi folks. I know that a lot of your family members are on Medicare and Medi-Cal, and this may very well be you, the non-Magi population. Okay, let's talk about the asset limit changing. Okay, so this is the history of it. Just to give you a background, back before 2022, we had $2,000 of asset limit. It was old school times where it was $2,000 and that was it. Or $3,000 for married couples. Back in July of 2022, they upped it to 130K. And then back in 2024, they went ahead and eliminated the asset test, which was amazing, wonderful, awesome. For the 2 years that we had no assets, it was amazing and it made my job so much easier. Unfortunately, we're no longer in those days. Currently, the current limit right now, as of January of this year, we went back. We kind of went backwards, okay? We went from no asset test back to 130K or 195K for married couples. Unfortunately, we're going to also kind of go back, not fully back, but kind of in the middle back, if that makes sense, for starting January of 2027. So we're like 5 months away from this hitting. The asset limit will be reduced to 21K for single folks and 31K for married individual or married couples. So let's look at it. Currently, for a single person, it's 130K asset limit. For married couples, it's 195K. It may be more if you're eligible for spousal impoverishment, which is another presentation I've done. You can find it on the YouTube page. And then 65,000 for every extra person in your house. But again, starting in about 5 months, we're not too far from 2027, y'all. It's going to get reduced to 21K for a single individual and 31K for married couples. Again, if you're eligible for spousal impoverishment, it's not these amounts, it's going to be a little bit higher. But again, another presentation topic for another day. And if you do have other folks in your household, 1,550 for every extra person in your household. Okay, so this is the current rule. This is the future rule. This applies to all non-Magi Medi-Cal groups. So what we call age, blind, or disabled, or the ABD population. This applies to the share of cost folks. This applies to nursing home or what we call long-term care Medi-Cal folks. This applies to the 250% working disabled program. This applies to the Medicare Savings Program that includes Quimby, SlimB, QY. This includes, all folks who are receiving MSSP services, those who are on ALW, all the waiver services that require full scope, full scope or have Medi-Cal. It's going to impact all non-Magi Medi-Cal groups. Okay. This is from DHCS. Here are the examples of assets that they count and don't count. So keep in mind, Medi-Cal doesn't count everything. They do give you exemptions on property. So the things that don't count are your residence. So if you own the house that you live in, they do not count it. But if you own a second home or if you own a home that you're not currently living in, it may be considered non-residential, and that may be counted. One vehicle is not counted, but if you own a second vehicle, it will be counted. Furniture, clothing, those things are not counted. I should do X's on this side. But any sort of cash, whether that's cash in a bank account or cash under your mattress, technically that counts for Medi-Cal purposes. Retirement funds, I'm going to put a little star here, DHCS, just if you're getting regular payments from it, it's called periodic scheduled payments. If you're getting periodic scheduled payments and the balance of whatever's in your retirement fund doesn't get counted. It still does get counted as income for the distributions that you get. But any sort of cash that you have in a CD, a checking, a savings, a brokerage account, those are going to count. Okay. This is the formal list. I'm not going to go through it all, but this is the formal list of Medi-Cal assets that do not count, that are all exempt. You can find this in this link here. Okay. All right. We're still talking about the who. Let's talk about our 19 and 64-year-olds. Okay. We've talked about our undocumented population, our humanitarian population, our non-Magi folks with the asset limit. Let's talk about adult expansion, 1964-year-olds. Let's talk about that work requirement that y'all have been hearing about and the renewals that are going to be twice a year now. Okay, work requirements. Currently, the current rule is you don't have to work for Medi-Cal. You don't have to show that you're working. If you're not working, you can still get Medi-Cal. That's going to change for certain populations. Starting in January 1 of this year, so that's 5 months away, we're really close to a lot of these changes happening. Starting January 1 of 2027, there will be work requirements for those who are 1964, and we're going to talk about excluded populations in the next slide. They're calling it community engagement. I call it work requirements because it's a little bit easier, but technically is you have to show that you have at least 80 hours a month in work or employment, in work training programs. You could be in school, so school hours can also count. And if you're doing community service, those hours also count towards the 80 hours per month requirement. You either have to do 80 hours per month or earn at least $580 per month in earnings. So it's an or situation, either a certain number of hours or a certain amount of earned income. But let's talk about who's excluded from this because it's a long list. Okay, excluded folks. We got our parents, our guardians, our caregivers, caregiver relative or family caregiver of, and again, a dependent child under 13. So we're not talking about all parents. Sadly, there was kind of this carve out with HR 1. They didn't include all parents. They included only parents of children ages 13 and younger. Okay. Or if you are a caregiver of a disabled individual, or what we call medically frail. This is an HR1 term. This includes those who are currently receiving SSI or SSDI. This is all, again, language from CMS or from HR1. Disability with at least one impairment in activities of daily living. Activities. These are really defined loosely, so we're still kind of waiting to see what this really will look like. Activities of daily living. Okay. Substance use disorder, this excludes if you have been in stable recovery for the last 5 years. What they call, quote, serious or complex medical conditions. CMS specifically has said, hey, a diagnosis alone, like having a particular medical condition or diagnosis, isn't going to be enough. You're going to have to show a little bit more. And we're still waiting for guidance on what that looks like. If you are receiving Medicare, you're going to be excluded from the work requirements. If you're pregnant, you're going to be excluded from the work requirements. A veteran with total disability rating, you don't have to worry about work requirements. Foster care or former foster youth under age 26, you don't have to worry about work requirements. Are Indian Americans, Alaska Natives, California Indian, who are essentially, if you're eligible to receive Indian health services, you are not subject to work requirements. If you're in compliance with TANF requirements, this is it's kind of a little bit outside of my wheelhouse, but if you meet these requirements, then you meet the requirements, the work requirements for Medi-Cal. Okay. Oh, I think I did the same thing. Or SNAP. Okay, so TANF or SNAP, CalFresh work requirements. If you meet those requirements, you meet the Medi-Cal work requirements. Individuals who are in a drug or alcohol treatment or rehab program, and individuals who were recently released from incarceration in the last 90 days. All of these folks are excluded from the work requirements. They do not have to worry about the work requirements. Keep in mind, if you are subject to the work requirement and your Medi-Cal gets terminated or denied because you did not meet the work requirement, HR1 specifically has said you're not going to be eligible for Covered California with premium subsidies or premium assistance. You could go to Covered California and pay full price, but you're not getting any premium discounts. Yeah, so keep that in mind. Okay, here's kind of the fine print. This is what the Medi-Cal website has about the work requirements. Okay, I want to stop here if anyone had questions about anything so far. Do the limits apply to those that are disabled? Yes. Yes. Okay. Any other comments, questions, concerns before we move on? I know I've thrown a lot of info at y'all, but there sadly is so many changes happening right now, but I want to make sure I'm comprehensive, even if it means we're going a little fast. Okay. Oh. The asset limit in January, that doesn't apply if you already gotten Medi-Cal. No, it applies to everyone. Or it applies to non-Magi folks. Applies to non-Magi folks. Even if you got Medi-Cal already. I'm happy if there's more to that question, county resident, I'm happy to elaborate if you want to put it in the chat or come off mute.
Hi, can you hear me?
Yes, go ahead.
Hi, so I'm currently working on a spend down plan so that my father is eligible. for
Okay.
Medi-Cal, and we're working with a consultant to get him on as soon as the spend down is complete.
Okay.
So if we get him on before the end of the year, I'm just asking, like, he's 77, he has dementia, he has like in-home nursing. But we wouldn't have to further spend down to 21K in January to or risk getting kicked off. Like, would we be grandfathered in because he's accepted before the end of the year?
So we haven't received official, no such thing as this grandfathered kind of language. Um,
Okay.
so eventually, the way that it works when we reinstated the asset limit, excuse me, hold on. That it worked, it was the counties didn't ask for asset information until your next renewal, but
Mm,
we don't know how it's going to happen yet because we haven't gotten guidance about this new asset lowering. So there's no such thing as grandfathered. Eventually, folks like your father will be subject to 21K asset limit. I just don't know when in 2026 that'll happen, whether it'll be immediately in January, but more likely than not, it'll probably be 21K at his renewal. So if he just got
okay.
renewed, at the end of last year or say this year, then it'll be that same month, the 12 months from that point. Excuse me.
Okay.
So unfortunately, the bad news is there's no such thing as grandfathered. The 21K will apply to anyone who had an asset test that applied to you previously. So everyone who met the 130K are now going to be subject to even a lower asset test the
Oh my
next year in
goodness.
2027.
Okay.
Excuse me.
And you're saying you have to renew more than once a year?
For some populations, yes, non-magi will still be once a year. But we'll talk
Okay.
about yeah, we'll go into more detail about who that's
So
impacted.
best case scenario would be if it's only once a year, we'd have the whole of next year until his renewal to get to that 21K,
No,
hopefully.
nothing
No.
confirmed
Yeah.
yet from
Yeah, yeah.
DHCS. That's kind of how they
Yeah.
applied it with the asset test coming back. So I don't know
Okay.
how they're planning on doing it. If they're just gonna say, well, now everyone starting January 1, we're gonna just start looking at everybody. I don't think that's what they're gonna do because that's just way too many Medi-Cal cases to look at.
Yeah.
But I have a feeling more likely than not, don't quote me, but more likely than not, it's gonna just be happening whenever your renewal month is for next year.
Okay. Okay.
Yeah,
Thank you.
of course. Good questions. Great questions. Okay.
I've got a quick question.
Go ahead, Marcia.
Okay, does the spend down affect their income? So just say you're trying, for example, my mom's only got like $27,000 in her savings, and um, so if we took it out, would it affect her income? Like, just say we took out 10,000, does that affect her income for the year that they look at?
Um, s- um, that's a nuanced answer because there's such thing there spend downs. There's certain types of ways to quote spend down your money without it impacting your eligibility. And then there are if you just transfer it out and gift it to somebody, um, then it might include what they call periods of ineligibility, depending on how much it is. Um, yeah. So, Marsh, if you are an OC resident, I recommend that you call. If you're not an OC resident, at the end of the presentation, I'll include a number for other legal aids that may serve your county. Because it's a nuanced question. There's something called spend down, and then there's something just called gifting or transferring. And spend down doesn't lead to ineligibility of Medi-Cal, but transferring may. So I want to make sure we're giving you, really specific. I can't give you specific legal
No,
advice under
no,
this
no
system.
worries, no
Yeah.
worries. Thank you very much. Thank
Okay.
you.
All right. But very good question. There is a difference between spend down and what we call transferring or gifting. Um, yeah. Okay. Okay. I'm going to move on. But let me know if you all have questions along the way. Okay. Again, this is for the adult expansion population. Okay. So more Medi-Cal renewals. This does not impact the non-Magi population that we just talked about. Anyone who's subject to an asset limit will still have renewals once a year. But let's talk about this. Currently, you must renew your Medi-Cal every 2 months, but for starting in January of this year, again, in about 5 months, it's going to be every 6 months for the adult expansion population, so the 19 to 64 population. Okay, but this still excludes, so we're not talking about our pregnant persons, we're not talking about our kids, we're not talking about parent or caregiver Medi-Cal beneficiaries, we're not talking about our age blind or disabled population, not our non-Magi population. So again, if you have an asset limit, this Medi-Cal renewal every 12 months thing is not going to apply to you. You're still going to have it every 12 months. Essentially, though, that if it does impact you, it's going to lead to more paperwork. You're going to get these yellow packets twice a year instead of once a year. Oftentimes, folks kind of don't fill this out, or they don't mail it back, or maybe they mail it back but don't send like verification documents or proof of income. It just ends up being more paperwork, a more delay in processing time, and longer wait times for everybody else. So just keep that in mind. It's going to be a lot busier at Medi-Cal County offices. Okay, and this is again the fine print from the DHCS website about these more often Medi-Cal renewals for this population. Okay, so this is where we are at. We did the who. Yay, congrats everybody. We talked about the who. We finished this first section. Let's talk about the what, okay? All right, what Medi-Cal services are changing? GLP-1s no longer being covered for weight loss. Let's talk about that. The enrollment freeze, we've already talked about that, but I'm going to go over it again. The dental benefit renewal for undocumented populations. And then this, we're going to talk specifically about the reduction in enhanced care management and community supports, which is impacting everyone, not just certain populations. It's impacting every Medi-Cal person. Okay, GLP-1s. Before January 1 of 2026, Medi-Cal did cover GLP-1s for diabetes and for weight loss. But starting up January of this year, so this change has already gone into effect, no more weight loss. So unfortunately, if you are receiving GLP-1s for weight loss only and not for diabetes management, your Medi-Cal will not be covering and paying for those. And that includes, you know, all the different, I mean, the Ozempic's the most popular one you probably hear about on TV or newspapers, but it includes any and all GLP-1 coverage. Okay, Medi-Cal for undocumented, we already talked about this. These folks, unfortunately, will lose their dental. Again, they'll lose their dental coverage, but they still will have emergency dental care. So keep that in mind. If you have severe pain, infection, or need an emergency tooth extraction, those are still going to be covered by Medi-Cal under emergency services. But again, tooth cleanings and regular outpatient stuff, unfortunately, these populations will no longer have Medi-Cal covering those things. Okay. Okay, again, the difference between, here, we're looking at this one, full scope Medi-Cal with no dental will be here. Essentially, you get all these services if you still got the full scope, you just won't have dental coverage. Okay, we went through this before. I'm going to skip through, but again, the no Ghostbuster sign with the dental tooth. Okay, reductions in enhanced care management and community supports. This is the current policy. You have to be, you know, there's certain populations that get ECM and certain criteria to be eligible for, you know, various community supports. And that current policy resides here in this link. However, starting January 1 of next year, which is about 5 months away, they're going to be changing eligibility criteria. They're going to be changing the service definitions, and they're going to be changing what they call utilization management criteria. So essentially what all of this means is less people getting ECM, less people getting community supports. So I don't have more details about this, unfortunately, because we haven't received guidance on what all of this stuff will look like. But just know that potentially, if you are currently receiving enhanced care management or community support services, you might get a cut or terminated. We just still don't know what this looks like. Does this include the assisted living program waiver program? No. Assisted living waiver program, it's its own separate thing. It is not part of enhanced care management or community supports. So Pia, you and your clients or whoever you work with are good to go. Okay. All right. So congratulations. We've answered the who and we answered the what. Now let's talk about the how. Okay. We're going to talk about co-pays. Co-pays in Medi-Cal. That's never existed, but unfortunately, in the near future, it's going to. We're going to talk about reduced retro Medi-Cal, and then we're going to talk about monthly premiums, and then some folks losing their Medi-Cal plan and going to what we call fee for service. So we're going to talk about each of these things in separate sides. All right, let's do it. Okay, how your Medi-Cal care or services, how you get Medi-Cal is changing. Okay, well, we just went through this. Okay, currently, no copays in Medi-Cal for adult expansion. Currently, you just don't pay. It's free 99. That's kind of the point of Medi-Cal, is that it's a low income program for those who can't afford copays. But unfortunately, with the passing of HR 1 starting in October 1st of 2028, so we still have some time, but we'll blink and 2028 will be here very soon. There'll be $35 copays per service for adult expansion. So this amount is up to $35. I think that they're still working out how much eventually the copays will be. But I'm conservative, so I will always put like a more conservative, scarier number. It's up to $35 per copay amount for services. And this is only going to be impacting those, not only, but there's a little carve out for those who make more than $15,560 per year. So anyone who's making under that do not have to pay copays. But let's talk about who this excludes. So the copays are not going to apply to pregnant persons, not to our kids, not to parent caregiver Medi-Cal beneficiaries, not to our age blind and disabled, and not to our Medi-Cal folks, Medicare folks, I'm sorry. And then also, this is not for emergency services. So if you go to an ER, you're not going to have to pay the $35 copay. To see your primary care physician, you're not going to have to pay. Ooh, what is that? Oh, what is that? Okay. And then if it's for prenatal care, you won't have to pay. For pediatric care, you're not going to have to pay a copay. For mental health or substance use treatment, you're not going to have to pay the $35 copay. $35 copay most likely is going to happen at your specialists. So if you're seeing a podiatrist or cardiologist or orthopedic, pain management, any specialist you're going to see, if you are within this population and you make more than this amount and you're not any of these folks, you're going to be paying up to $35 each visit to those doctors. Okay. Okay, and then this is the DHCS website. Copay, kind of the fine print stuff. Okay, any questions before we move on to retro Medi-Cal? Okay, all right. Currently, you can get up to 3 months of retroactive Medi-Cal. Okay, so for example, let's look at this example here. You apply in April, okay? You can theoretically get, if you're eligible for it, March, February, and January. So even though you apply in April, if you show that you financially meet and all the other, you meet all the other Medi-Cal criteria back in January, February, and March, you can actually get it retroactively covered for 3 months. 3 months. But starting in January, and again, about 5 months from now, for the adult expansion population, it's only going to be 1 month. So no more January, no more February, only March for this example. And then only 2 months for everybody else. So January is definitely out of the picture. February will still be available for everyone else besides the adult expansion population. Oops. So, I mean, for some people, this is not a huge deal because they didn't have any medical bills from the past. But for some, like for example, if you were like hospitalized back in January and you had a huge hospital bill that, Medi-Cal could have covered before, having one less month or two less months of retro Medi-Cal can make a huge difference. So this is a huge change that can impact a lot of folks. Okay, here's the fine print for the retro Medi-Cal rules changing on the DHCS website. Okay, we talked about this. Okay, let's talk about the switch. We're talking about those who are getting switched from the Medi-Cal plan to what we call fee for service. Okay, and this is considered for those with, quote, unsatisfactory immigration status. All right, so currently, immigrants with, quote, unsatisfactory immigration status, again, I don't like to use this phrase, but it's the phrase that legally is being used. Those folks are, if you are currently enrolled into a Medi-Cal plan, these folks right now in OC, at least it looks like the CalOptima Medi-Cal plan or the Kaiser Medi-Cal plan. Okay. Starting in January of 2027, and this is going to be just in a few months from now, all of these same folks are going to be transferred to fee for service. Okay, so let's talk about what that means. Medi-Cal services are still free. I know this sounds really silly. I don't know why they call it fee for service. You're not paying the fee. It's still free. It's still Medi-Cal, but you're just not going to get it with CalOptima or Kaiser or with a plan. You're getting it directly from fee for service providers. So for example, you're no longer going to be able to see your Kaiser doctors or your CalOptima doctors. You can only see doctors who are enrolled in what they call the fee for service program for Medi-Cal. So keep that in mind. The way that you get Medi-Cal will be changing for these populations because a lot of the Medi-Cal plan doctors may not already be enrolled as a fee-for-service provider. So you may be changing doctors, providers because of this change. This also means you're not getting enhanced care management and you're not getting community supports because these are actually services that are provided by the Medi-Cal plans. You don't get these same services under fee for service. So again, a huge change for these populations. It's an estimated 2 million Californians are considered, quote, UIS or unsatisfactory immigration status. So it's a big group of folks. Let's look at the next slide for the full list of UIS folks. So I put this all here. This is from the DHCS website. All of these immigrants, immigration statuses are considered UIS. So all of these folks will be moving from a Medi-Cal plan over to fee for service. So again, if you're in Orange County, no more CalOptima. And if you're in Orange County, no more Kaiser. If you are one of these immigrant populations on this list. Okay, I'm going to move on because we only have a few more minutes left. I want to make sure. Here's the fine print. Again, this is all from the DHCS website. Just kind of similar information that I've already presented. Here's the timeline. So just kind of summarize all these many changes that we were talking about. For the immigrant populations, again, the enrollment freeze has already happened. This was starting of January of this year. The transition from Medi-Cal plan to fee for service, that's going to happen in January of next year in about 5 months. July of next year, that's when the dental coverage will be removed for certain populations. This is when some of the folks, the humanitarian population will go from full scope, full to emergency Medi-Cal. Remember the refugee asylee folks. And then the monthly premiums, again, we still don't know, but it might be 30 to 50 bucks a month. Okay. And then for older adults, the asset limit starting July, that's not right. Well, let's see. Maybe that is right. I thought it was going to be January. It's supposed to be 21K. I'm going to confirm this. I feel like DHCS has made a mistake, but maybe they didn't and they changed it to July. But this is going to be 21K. and then 31K for married folks. And then for the adult expansion population, the work requirements will be January of next year. The retro, this is the retro Medi-Cal, going from 3 to 1 month. And then starting March of 2027 is when their renewals will happen every 6 months versus every 12. And then the co-pays are going to hit in October of 2028. Okay, so this is basically a timeline of the Medi-Cal changes. Some good news. I want to leave off on some like positive stuff because I know a lot of this news is really can be quite damaging and really impactful for a lot of our folks. And so let's leave off on some good news. Medi-Cal acupuncture was saved. At one point, there were proposals to get rid of acupuncture Medi-Cal coverage. Luckily, that didn't pass, and so we're good to go with acupuncture. You could continue to remain eligible to receive acupuncture services under Medi-Cal. IHSS was on the chopping block. Luckily, no cuts to IHSS at this time. So thankfully, if you are an IHSS, you should not see any changes. Okay, PACE for the program of all-inclusive care for the elderly. At one point in time, there was some talks about proposals to cut the PACE funding. Luckily, that didn't pass. Mobile crisis services, again, no changes to behavioral health crisis response services. That's going to remain. Medi-Cal asset limit. So keep in mind, they were talking about dropping it all the way back to the old school days of $2,000 or $3,000 for an asset limit. But again, they changed it back to, luckily, they upped it to 21K. I know 21K is still a huge drop from 130K, but just keep in mind the original proposal was going back to 2K. So as much as we don't see this as a win, it's still a semi-win. Okay, some good news. The California budget is revisited every year in January 1. So that's why this presentation is timely, because a lot of these changes, we found out about, on July 1 when the California budget got finalized and approved. So we get to revisit some of these issues again next year. So maybe some changes for the better, maybe restoration of prior cuts in services. So keep that in mind. How to reach our office. Oh, what's happening here? Okay. You can, if you are an OC resident, you can call our number. You press 1 for the health unit, or you can fill out our online intake on our website during off hours. And then we also have other Know Your Rights presentations. I'll skip that. And then here's our survey. Okay. I'm going to go to the chat because I do see some questions. How about non-emergency Medi-Cal transportation? Is that still covered by Medi-Cal? Yes. NMT, NEMT services are still intact. There hasn't been any budget cut changes to that. So no worries, Pia. Yes, we're good to go there. Yeah. Okay. Susie has a question. What about the changes under spousal impoverishment programs? No changes with spousal impoverishment. Spousal impoverishment rules still remain in place. But they kind of work in tandem with the asset limit changes. So, it's still going to be, now it's going to be 21K for each spouse instead of 130K for the asset limit. But Susie, if you have specific questions and you're an OC resident, please give us a call, because spousal impoverishment, it really comes down to the details about income and assets and all that jazz. So please feel free to give us a call. And let me put in. Let me see if let me find the number for the Health Consumer Alliance for other counties. All right. Any other? I know I'm going over, and I'm sorry, Kim, I'm going over, but if you need to go, Kim, I'm happy to still monitor
No problem
and
at all.
answer any questions.
I
Okay.
can stay on.
Okay. Does anyone else have any questions, comments, concerns? let me put in for folks outside of Orange County, Health Consumer Alliance is 888 805 3536. Yes, if you call that number and enter your zip code, it'll connect you to the legal aid office that serves your county. They have their own health unit, just like we do here at Community Legal Aid SoCal. But yeah, call if you are outside. Call us if you are in Orange County. Call the Health Consumer Alliance 888 number if you are outside. Where can we find guidelines on how to reduce assets before that? Let me look that up for you. If you Google, let me just Google. I don't have the link here, but Google MC007 DHCS. It's actually like a form, and you have to scroll down, but Medi-Cal does give you a list of examples of ways to do spend down. And ways that spend down, which won't trigger like periods of ineligibility for long-term care Medi-Cal. And then they also talk about transfers, which may trigger a period of ineligibility for long-term care Medi-Cal. But you know what, Kim? I can go ahead and send you these links, and I'll put in the 888 number for the non-OC folks. Okay. And then the slides. Okay, so Kim, I'm sending you slides, this MC007 form about spend downs, and then I'll also include the 888 number for HCA.
Thank you. And I'll send
Okay.
to the participant.
Perfect. All right. All right, folks. Last call for comments, questions, concerns before I let you go on this lovely Monday afternoon. Will IHSS benefits be changed depending on asset limits? Yes, yes. Laura, to be eligible for Medi-Cal, you have to have, I'm sorry, to be eligible for IHSS, you have to be eligible for Medi-Cal. So if you are over asset for Medi-Cal, that means you would be over asset for IHSS. So in that sense, it does impact IHSS coverage and services. But if you have questions about your particular assets, feel free to give us a call. If you're an OC resident, yes.
Well, I guess that's it. Thank you,
Okay.
Joan. And it's always good to have you as a presenter because you just have the wealth of knowledge and just the way you present, very informative, really slow, easy to understand. So thank you so much for joining us today. And like I said, I will send the recording and all the information, like the slide and all the information that you share to the participant when we have everything ready. And at the end, when you exit the Zoom, you will also receive a survey about the class today, and you can take some time to fill out the survey. And that's it. Thank you so much, everyone. Thank you.
Thank you.